Okay. Hello, Liz. My name is Dulce, and I am the speech language pathologist here at UT Health Clinic. How are you doing today?
I'm good. How are you?
I'm doing well. So first of all, thank you for coming in today. I've read a little bit about the voice problems that you've been experiencing, but I have a few questions for you that'll hopefully give me some answers and more of an idea of what's going on with your voice.
Okay.
So let's just start with what brings you here today.
So my voice has been very breathy recently. I had a surgery in my lungs a couple of months ago, and ever since I woke up, it's been very breathy.
Okay. How long ago did you have this surgery?
In January.
In January. Okay. And so you said that you noticed it right away, right after your surgery?
Yeah, yeah.
Okay. And so do you notice this problem is consistent or is it more intermittent?
It's pretty consistent, and it's hard to get really loud too.
Okay. And so is there a certain time of day where you feel like your voice is the best?
Maybe a few hours after the morning, once I've had time to kind of get up and get ready and everything, but it does kind of get worse throughout the day a little bit.
Okay. And has it changed over time, the quality of your voice?
No, it's pretty much been the same. I was hoping it would go away, but I haven't seen it go away yet.
Okay. What is your current occupation?
I'm a therapist.
Okay. So I'd like to know a little bit more about your medical history. Besides the surgery, I know you mentioned the surgery, but do you have any other previous diagnoses or anything like that?
I have sometimes had blood clots in my lungs, so I'm on a blood thinner medication. And so that's what the surgery was for.
Okay. Are you on any other medications besides the blood thinners?
No, just a vitamin and allergy pill sometimes.
Okay. Um, Tell me about your alcohol and tobacco use.
I don't use tobacco, but every once in a while I'll have a social drink.
Okay. So I am going to read a couple of statements and then I just want you to indicate whether you experience it or you don't. Just say yes or no. Okay, so poor morning voice quality,
No. Well, yes.
yes. Okay.
Those four.
Frequent throat clearing,
Yes.
okay. Increased phlegm in the throat,
Yes.
tastes repeating after meals. So basically, you eat something and then a little bit after that, you can taste what you had in your mouth.
Sometimes, yes.
Okay. Increased throat and mouth dryness,
No.
frequent burping,
No.
okay. Feeling of throat tightness,
No.
throat soreness or burning sensation not related to illness.
No.
Okay. Coughing episodes not related to illness or swallowing.
No.
Okay. Heartburn.
Yes.
Okay. Feeling of a lump in the throat when swallowing.
No.
Okay. Bad taste in the mouth, such as anything sour, acidic, or metallic.
No.
Okay. Unpredictable or variable voice quality during the day.
No.
Okay. Increased coughing when lying down.
Yes.
Okay. Now, what demand does your voice place on your work life?
I'm pretty much talking all day long. So patients have definitely noticed a difference. So yeah.
Do they ask you to repeat yourself frequently?
No, because we're in a very quiet room, so it's usually not that impacted there. But some of my patients who have hard of hearing do have trouble hearing me sometimes.
Okay. And what would you say the demand your voice places, like in your home life or your social life?
It's probably used pretty frequently at home. I live with my kids, so I'm usually talking to them or telling them to do things all the time too.
Okay. Is there any additional information that you would like for me to know that you feel will help me understand your voice problem?
Um, I've I don't know if this is related, but I've had some swallowing problems too, and I don't know if I can address that here if I need to make an appointment somewhere else, but that was also kind of a concern.
Yeah, I think we can definitely address that here once we get to what the root of the problem is. So I'm glad that you told me that. But now I'm going to go ahead and ask you some questions. And these are just some, not questions, just read you some statements that a lot of people have used to describe their voices and the effects of their voices on their lives. And so I'll read you this statement, and then I want you to indicate how much that affects you. 0 is never, 1 is almost never, 2 is sometimes, 3 is almost always, and 4 is always. And if you need me to repeat that, just go ahead and let me know, and I'll repeat it for you.
Okay.
Okay, so my voice makes it difficult for people to hear me.
4.
I run out of air when I talk.
1.
People have difficulty understanding me in a noisy room.
4.
The sound of my voice varies throughout the day.
1.
My family has difficulty hearing me when I call them throughout the house.
3.
I use the phone less often than I would like to.
3.
I'm tense when talking to others because of my voice.
4.
I tend to avoid groups of people because of my voice.
3.
People seem irritated with my voice.
2.
People ask, "What's wrong with your voice?"
4.
Okay, well, thank you for answering those questions. This is all of the questions that I have for you today. So I'm going to go ahead and send you to the rest of your evaluation, and then we'll get back to you with some of my results.
Okay, thank you.